This is a progressed version of spine segmentation where we have kind of gained a lot of awareness in a more regressed, easier position, and we're getting ready to load that position. We want to progress it a little bit more into more of an upright position like life really requires of us on a regular basis. So for this exercise, we are going to go into a hip hinge position. To find a hip hinge, you want to make sure you can feel your tripod on your foot, so your fifth and first metatarsal head and your heel. Make sure the weight is even there. We want some soft knees, but I don't want a full squat. So soft knees, let those knees kind of come forward a little bit, shins come forward slightly. And then from here, I want you to reach your butt back as far as you can. Now, a lot of people will reach their butt back and they will come all the way down. We don't necessarily need to do that. As soon as your butt stops traveling back or you feel like you're gonna fall over, you're good there. If you feel like you can't find that position, please use a little bit of support from a chair, a stick, the wall, where we put a little bit of weight forwards here and we just reach until we can find a good stretch. And then from here, you can shift back into your hips a little bit more and take the weight off of your hands as you're able. If this is all you can do, or you have a little bit of low back pain, please give yourself support. And if you still have back pain, this isn't an exercise for you. This should be pain-free. Now from here, in this position, we are going to think about slowly segmenting our spine from our tailbone up and then from our head down. So tailbone up is going to look like slowly tucking that tailbone, slowly one segment at a time, working our way up our mid-back, into our upper back, and then our head will tuck down. We want to make sure there's not a lot of movement elsewhere. Now from here, we probably have lost a little bit of the tension in our glutes and hamstrings because we are rounded, totally fine. From here, you should get back into that though by extending, reaching the tailbone back, then slowly working your way into extension all the way up into your mid-back, your upper back, and your head. That would be 1 rep. You're gonna do the prescribed amount of reps there. Then from here, we're gonna start head down. Tuck the chin, round your upper back, into your mid-back. Try to maximize your movement at your upper and mid before the low back helps. Round as much as you can there, then reverse. Head, chest, comes up like you're showing somebody something really cool on the front of your shirt. Then move into your mid-back and your low back. You should feel lots of tension here again. We should make sure we didn't shift forwards or shift too far back. We shouldn't be in a squat. You should really make sure we are relatively stable there. And then you can do the prescribed amount of reps from the head down. Very often I will have people do tailbone up and head down before they get a break. But if you need to, break this up as you can because it can get very fatiguing. Once you've done that, you've done 1 set of the exercise. So make sure you do the prescribed amount. We're working on slowly adding more to build some endurance of the muscles in your spine, which is really good because you want good endurance so you can do anything you want with your spine. Again, make sure this is not painful. We don't feel any pinching or pain anywhere. If you do, you probably need to consult a medical provider or a physical therapist. As you do these, you should feel that the fatigue is a little bit less. You have a little bit better segmental control, and you should feel like you can get a little more range of motion in that exercise. Those are all going to be signs of progress. Make sure you do them very consistently. Try to slow them down and feel 1 segment at a time, even though the burn is very real and we want to rush them. Make sure you go slow and you'll get the most out of the exercise.